So delighted to be joined by Miss Anna DeLeo, a highly experienced and extremely well-regarded plastic reconstructive and aesthetic surgery consultant. And Miss DeLeo, I'm so happy that you're with us to talk about tummy tuck this afternoon. So one of the first questions, what questions should I ask my plastic surgeon about tummy tuck surgery before undergoing the procedure?
Hello, everybody. Welcome today and talk. So I think what is important to ask if you are really ready for the surgery, is an important procedure, and so it's better to get ready to reduce the complication, to have an easy journey. And there's the team that usually operate on you will explain a lot of things. And so sometimes having more than one consultation can help to summarize what we can do to prevent, bad events. Bad scarring, even a simple bad scar could ruin the job that the surgeon does it. So that's why there is a lot of time to spend to prepare for the surgery.
Absolutely. Thank you, Ms. DeLeo. And then following on then to our second question, how will patients know if they are suitable candidates for a tummy tuck?
You are a suitable candidate, first of all, if you are in a good health. And sometimes, after pregnancy or after weight loss, your body needs a bit of time to recall your energy and to do a good surgery, to do a surgery without painful problems.
Absolutely. And you mentioned there, Mr. Leo, pregnancy, and that's a very interesting point. How can people expect their stomach to look after the surgery, especially if they have been pregnant in the past?
Tummy tuck surgery give amazing result. We are able to reconstruct abdominal wall. And that's the good things of tummy tuck, restoration of the tissue that have been damaged, not only after pregnancy, sometimes obesity does worse. We reconstruct and suture and replace strength in the central part of the abdomen with plastic surgery techniques. And every patient needs different things, so it depends.
Absolutely. Thank you, Ms. DeLeo. And then I suppose then talking about complications, I suppose like any surgery, there are some side effects or risks involved with tummy tuck.
Yes, surgery are always happening with some risk. Bleeding, scarring, infection are the risk that we cannot avoid it. But we can prevent a lot of wound healing problem. That is the most common complication after a tummy tuck surgery. If we prevent that, a patient is already halfway through, because the big scar can be a bad scar, a firm scar, if we don't treat the wound in a good way. And that's is one of the most common complications that is usually not really considered by patients. Why it's really important to prevent that. We follow them up, we give them advice, but the problem is it's difficult to be compliant, because at the end, if you do everything all right, you are on your feet after 7 days. And so life usually comes before your wounds. And that's the problem. Then obviously there are some other bad complications, but we are extremely lucky to have staff that help patients and support the patients to don't get into troubles.
Oh, fantastic. It's so important to have that team, Mr. Leo, like you say, to support and offer reassurance to patients. Fantastic. And then I suppose some benefits of tummy tuck. I'm sure there are plenty of benefits of the surgery.
Tummy tuck surgery is not only for vanity, and is a great surgery that restore abdominal health. Inside of the abdomen, we got the urinary system and the bowel system, the digestion system. If these two they are not working well, obviously we don't have a good quality of life, and that's why elderly people, they struggle with their body. I think tummy tuck give you longevity. So if unfortunately some event happen in your life and you get bigger than you should be, plastic surgeon can give you more energy, probably. Yes, to give you more energy to get into your elderly life. Then it's always a sign of obesity or pregnancy. It's always a sign of that. But we help you to get a better life.
Oh, fantastic. Absolutely. That's really, really good to hear, Ms. DeLeo. Many more benefits than risks, I suppose. So it definitely is. If people are considering undergoing a tummy tuck, what advice would you give to some patients?
I think to get informed well about the risk of surgery help you to prevent problem and be ready to do it. So we got nowadays some certain guidelines, rules on when we can operate and we can operate. Then environment and the hospital care and aftercare, nurse care, all of that support help you to have a better result, not only cosmetic but functional result, to have a better function of your body. Sometimes patients are invited to do more after. It's just at the beginning of a journey. And it's difficult to understand that after a big procedure that you pay it and you get through it, you're still not 100% well after 3 months. But next is rehabilitation, it's a new life, it's a new body to start with the surgery. And it takes time. More collaboration we get from patients, better result we got. And so that's why patients need to understand and get informed before surgery to understand if they are really true candidates to have the surgery done. And if they are, usually it's a life-changing procedures. So we made them super happy, in love with the plastic surgery benefit.
Oh, that's so good to hear, Mr. Leo. Fantastic. And I suppose there might be some patients who might want to maybe have the surgery again in a few years if they're not 100% happy with the initial surgery. And what options do they have if they're not very happy with how they look after a tummy tuck?
The scar, we said, in 10%, around 10% of the patients, the scar can be a problem for them. And so sometimes we do massages, we do everything, but they can end up to have scar revision surgery. That means we redo the scar in a certain point of it. And this happens often when we got a superficial wound infection after surgery. Then I redo a tummy tuck is rare in a plastic surgery practice, but unfortunately we see many cases, many patients that had a bad experience with the previous surgeries. And this means redo increased risk of complication after surgery. But it's often something worth to do because having asymmetries or firmness is uncomfortable. So every case is different, and so it depends on what kind of procedure was done before the one that I'm thinking to do. And I'm quite clear with my patients, and so I try to explain as much. And often they proceed and they are happy. Yes, unfortunately, that's we see more of these cases than cases they come from the first time to me.
Okay, absolutely. It's very, very good to hear that. Again, patients can be have peace of mind. They can actually undergo the surgery again, and they might be happier in the future. So that's great. And then, Mr. Leo, the last question then, the recovery time. I know you said earlier around 7 days, people can get back to their normal life. Or what precautions should they take in the recovery period?
It depends a lot of what kind. Tummy tuck doesn't mean too much. It depends how big you are and what kind of reconstruction we need to do it. So there are, the average of day out of work is around 2 to 3 weeks. Then coming back at, be able to go for a walk and have a coffee, that is definitely sooner than that. We tend to mobilize the patients as soon as, and to send them, to a normal life as soon as. Try to construct, personalize the journeys for everybody. So we ask what is the most important things that they wish to do it, and we prepare, we train them. They train, they go to the gym to do that. So we got a member of staff that meets them before surgery to discuss activity to do. We are on the same side of the journey. So we want to mobilize and give their life back as soon as. And exercising before surgery is essential. And how much compliance they are, how many of them they really go for training before surgery. I think a good 80%. We got good teacher, but not excellent students.
Oh, Miss Anna DeLeo, thank you so much. That really, really helpful information about a tummy tuck surgery. And if anybody watching or listening to the interview today would like to visit the Top Doctors profile of Miss Anna DeLeo, you can head over to www.topdoctors.co.uk. And Miss DeLeo, thank you again so much for your time.
And thank you to you. Bye-bye.